saw the video last time. So we saw in the video last time about frozen shoulder, what causes it, and how can it come about, etc. So if you haven't watched my video, go back to YouTube and then you can watch it on there. If you're watching this on a live, please say hello so I know you're here. If you're on the replay, please comment #replay so I know that you've been here. Okay, so for those of you who do not know me, my name is Swati. I'm a physiotherapist, and I do these videos to bring about patient awareness and for patients to know what's exactly happening when they get a diagnosis, when they have symptoms. So I strongly believe in patient education. So here I am. If you like what I'm talking about, please go over to my YouTube and hit that subscribe and the bell icon so you know next time when I come live. And today's topic, let's move on to that. So today we're talking about physiotherapy treatment and easy exercises for frozen shoulder. So this is like in continuation with frozen shoulder video from last time. So you will notice that there are lots of videos that talk about frozen shoulder on the internet, right? But they are mostly talking about advanced exercises. So when you have gone through, remember the three phases we spoke about? So where you're in the middle to the later phase, mostly in the middle phase. So I'm going to talk about the exercises that you can start off with. Even those people who are in the mid to later stage can do these exercises. Okay. So I will basically break it down step by step, right? So when you go to a physiotherapist, what they're going to do is they'll do an assessment for you. What that means is they will ask you your history and everything. How did the shoulder pain start? And then your treatment will depend on what was the cause of your shoulder pain. So it could be that a frozen shoulder has started after you've got a rotator cuff injury, or you've had a fracture in your forearm and you've been holding your hand in the sling and whether operated or in the cast, you've been holding it and you haven't done your shoulder movements very well, or you've done the shoulder movements but probably only up to here, not all the way up, and then you land up with a frozen shoulder. Or if you've had a surgery, or I mean any fall that you've not moved your shoulder, whatever the reason that we spoke about last time as well. So whatever the reason, the physiotherapist will take that into account. So one of the main complaints of frozen shoulder is pain. So if you go to a doctor, so just going on a little tangent here, if you go to a doctor, he'll give you pain medication. They will give you they can give you injections. So these are like steroid injections. Obviously they try and not give you more than like three to four, I mean 3 to 4 steroid injections per year. That is, I'm talking different parts of the body or the same part. But if you go with a frozen shoulder that hasn't resolved for a while, or if it's just too painful and you can't carry on with life, the doctor can give you a steroid injection. Works like magic. Your pain literally disappears. However, you do have to, that is your golden time. You have to carry out intense physiotherapy at that time, right? And then the doctor might even do manipulation under anesthesia. What that basically means is once you're in the later chronic stages of frozen shoulder and nothing's helping you just can't get movement back, what they'll do is they'll put the shoulder area under anesthesia, so local anesthesia. And what they'll do is they will manipulate the shoulder. So they basically force the shoulder into that range. Obviously under anesthesia you don't feel a thing, right? After you wake up and the medicines wear out, of course you can feel the pain, but then you get your range back again. You have to do intense physiotherapy in order to make sure you maintain the range. Otherwise you're going to go back into the frozen shoulder state again, right? All for nothing then. So I always tell my patients, if you're going to go through everything anyways and then do physiotherapy treatment, unless of course, it depends case by case, unless of course you are in like a lot of pain and you've had stiffness for a long time, I always tell my patients, please do some exercises and see how much you can benefit from physiotherapy before you go in for injections. Or okay, I'm getting a call. Sorry, somebody's calling me. So just give me a second. Just a second. Okay, sorry. So yeah, I'm back. Basically, I always tell my patients that go in for physiotherapy and Then after that, if you want to go in for injections or manipulation, which is manipulation is not so common, but there people do it. So do your physiotherapy first. So what happens is when a patient comes in, we ask him what is your pain scale. On a pain scale of 0 to 10, how much is your pain? First thing, if the pain is so much, then I will first do pain management. So what that basically means is I use modalities like ultrasound, a bit of electrotherapy as and when needed, and also use a hot pack before I start the patient on mobilizing, that is using my hands to get the movement back in the shoulder, and also the exercises. Now, that is my protocol. It can be different for other people. And I always end with a cold pack. So you can follow the same thing. Why I'm telling you is you can follow the same thing when you are doing exercises at home. Start with a hot pack. You don't want to do a hot pack, get into the shower, have a hot shower, normal, regular hot shower, right? Doesn't have to be scalding hot. A hot shower, so your muscles are all loose and flexible in that area. Do your exercises. At the end of it, do 5 to 10 minutes of cold pack, and obviously longer if you want to. But then do your 5 to 10 minutes of exercise. And okay, sorry. So, what exercises can you do? Right now, firstly is your mobility exercises, because one of the other main symptoms of frozen shoulder is stiffness. That's why it's called frozen shoulder, because your shoulder freezes. Okay, so first thing you're going to do is obviously you have to first see what is your baseline, what are the movements that you have got. So you have to check how much can you go up front ways, sideways, okay, and if you're, let me just put the screen down a little. And if this is your hand, how much can you take it in? How much can you take it out when you are at right angle? So your arm is next to you, forearm going in and out. So these are your baseline measures, right, for the shoulder. So the first exercise you can do is, suppose I have a problem going up this way. I can hold my two hands together like this, elbow straight. It doesn't have to be completely locked, just a little, like a 2 degrees, 5 degrees bend there. And then I'll just move back so you can see. And then I'm going to, suppose my right hand is painful, I'm going to support it with my left hand and try and go up this way. Okay, so that is supported movements with the other hand. What you can also do is get a stick, any stick actually, and what you do is you hold the stick in your two hands, and this again is the same thing. You are supporting yourself with the stick when you're doing these movements. So this was front. Okay, now what you're going to do is, another thing you can do is wall crawls. So obviously I don't have a wall in front of me, there's a window here, so I'll just show you. There are two types we can do for the side movement and we can do for the front movement. So for the side movement, what you have to do is you stand or sit near the wall, but then obviously you've got to have a chair that moves. And you know how a spider crawls? Yeah, you have to crawl up the wall, and you move closer and closer as you get higher. So you can actually go all the way up. So for example, if I was standing, I can actually go all the way up. I'm sure you can see it on the screen. The same thing you can do is when your hand is in front of you. So imagine there's a wall here. So you'll slowly crawl up the wall all the way, and obviously you move closer to the wall as you're doing the movement. Otherwise, you won't be able to go up the wall. And then when you're coming back, imagine those muscle fibers that are like lengthening. If you come back, like suddenly drop your hand down, what will happen? This. So you want to come back also slowly, right? So those are very popular exercises. Another one you can do is, if you take this stick in your hand, your arm to forearm here, this angle is at 90 degrees. And do you see the movement? If you focus on, say, this hand, so what's happening is out, rotating in. So you're doing your rotations. It looks easy, but when you have a frozen shoulder, most of the time it's quite difficult. Okay. Another one you can do with this stick is, I don't know if you can see this fully here. I'll move back. Here. Yeah. this all the way, and this all the way. So basically what's happening is you're doing this movement. Okay, when you're doing this movement, remember this sideward movements is difficult sometimes. I know we're going only up to 90-degree, but if you need assisted movement, this is actually a good one to do. Another one you can do is if you have okay, let me stand up and show you. Okay, can you see that? So you hold the stick there. With the help of the stick, pull your hand down and up, down and up. So this is your affected hand. The one that stays down is your affected hand. So what you're essentially doing is you're doing the same rotations, but you're doing it up and down the hand. Because if you remember, we referred back in our previous video, usually it's the strapping of the dress at the back which is a problem because your hands cannot reach this way, right? Okay, another quick one. Now I'm going as per the symptoms as well. So you'd realize I had spoken about combing your hair, or ladies who have longer hair and they want to put it up. Usually this action is also restricted. So what you're going to do is cross your hands, put them here. Now you might be here, you might be here, depends on what your stage of frozen shoulder is. And then slowly you're going to try and open up. Okay, so if you can go only this much and the other side can open up fully, it's okay. Then you swing this hand a little bit and try and coax it to go back a little bit more every single time. This you can do lying down in bed as well, so the rest of your body is well supported. um, Also, this exercise we had done in the very beginning, this you can do when you're lying down in bed so that you're not twisting your thoracic spine or your neck um, in a different position, so you basically stay neutral. Okay, so yeah, these are just some of the exercises that you can do. One good exercise, and a very simple one, you keep moving, is a pendular movement. So let me just get this chair out of the way. What you can do is, remember, do not do this. This is bending from the back. Poke your bottom out, down, and then what you're going to do is this. Just let your arms swing like a dead weight. Okay, and you can go, either you can go round and round, or you can go front and sides. So you can do this. Okay, this, and you can go around clockwise, anti-clockwise. What this does is, if you remember our ball and socket, oops, I'm off camera. If you remember our ball and socket joint in the first video, so remember, this is your trunk here, and this is the ball of this long bone here, the humerus. So this is the movement that should happen every time you're moving your shoulder around. But in frozen shoulder, there's less movement. Now, when you're hanging your arm down in that pendular swinging, essentially your socket is here and the ball is here. Because of gravity, the arm gets pulled down a little bit. So there's a little bit more space here. It's not like big amount of space, but a little bit more space around here. Obviously, it puts a stretch around that capsule. That's how you get adhesive capsulitis, right? Because that capsule is sort of stuck and it doesn't let the joint move and the groin gets stiff. Anyway, that's all in the previous video. So what this does is you get that little bit of traction on the arm, so a little bit space within that shoulder joint, and then you're doing sideways, forwards, backwards, or circular movements of the arm while your body is stable, right? So your pendular swinging will help you to get more movement. Patients report that pendular swinging is one of their favorite exercises, and that's why I saved it for the end, because they get a lot of pain relief. So many times I tell the patients, start with a hot pack or a hot shower if you can't do a hot pack. Go on to go on to pendular swinging, exercise number 1, then pendular swinging, exercise number 2, then pendular swinging, exercise number 3. And if you get tired, it's okay. These are mobility exercises. It's not like a strengthening set that you have to do together. Take a break. You have 24 hours, right? You got to do intense physio, but doesn't mean you're going to do exercises for like 2, 3, 4 hours at a row, right? Spread them out throughout the day. In fact, if you can, and if your situation allows, it is better to spread them out, because they will give that mobility again and again during the day to your shoulder, rather than just giving mobility in the morning and the evening, right? All right. So these were some of the simpler exercises. Obviously, there are like hundreds of exercise, but I always go for the simple ones, as those who are watching me would know by now. I always talk about the simple stuff, right? So you can go to your physiotherapist, learn a few more exercises. Of course, you need more work than just the exercises. You can come to me. You can ask me questions. I'm happy to help you, and I would be happy to help you. We can set up something, and I can help. We can set up some time, and I can help you out with these exercises for sure. And also, we gradually move on to strengthening exercises, because that's another complaint that comes in once you have frozen shoulder for a while. And if you've had a pre-existing injury or fracture or something that leads up to a frozen shoulder, then definitely you need to strengthen, right? So the strength, it is not that when my arm starts to go 100% up, or I regain my full mobility, then I'll start strengthening. Always strengthening exercises start in the available range. So if I can just go up this much, I will start to strengthen within this range, right? At least you're strengthening some more, some muscles there. You're not waiting for the arm to go up 100%, right? And meanwhile, another thing that people usually miss out is they tend to get weakness in their hands and fingers. So you can take a stress ball, you can do the squeeze. If you don't have a stress ball, roll up a towel, pop it into your hand about the size of a tennis ball, and then squeeze with all your fingers and relax. Squeeze. Initially, you can just do squeeze and relax, or you, and then gradually, as you get used to do it, start doing holds with the squeezes, right? And another one you can do is tie up a rubber band. Oops, I don't have a rubber band here, but tie up a rubber band around your fingers. Try and push them out. So you see, you're doing squeeze, so pushing in, and then you're doing pushing out as well. Or if you have one of those grips, so you're doing this and this, right? So if you have one of those grips that have the springs on them, and you can vary the resistance, that's good enough, right? So you can just do those springy resistance and gradually increase the resistance as you go. So that's something you can do. uh, if your pain is not too much, you can take some dumbbells and do your biceps and triceps work as well. You can do some wrist uh, movements with the dumbbells as well. I can guide you with those later. And yeah, I think that's basically it, what you can do at home. Please, please, please do use a cold pack at the end, especially if you feel really sore. And frozen shoulder tends to be a very painful condition. Do use a cold pack after. Oh yeah, another thing your physio can do is taping. So you must have seen all those sports guys with all the fancy tapes around them. Those bowlers, when they're playing cricket, they have a lot of tapes around the shoulder. That's to prevent those instabilities in the shoulder, which is another topic for another day. But that's another thing that can help you if you have any areas that need to be taped. um, can give you support, can give you feedback, the different types of tapes. Anyway, another topic another day. Okay, but that's something we can help you out with. um, okay, so if you like what I'm talking about and you want to explore similar topics, please go on to my free Facebook group. Its link will be in the description. And for those of you who are watching me on Instagram, I'll leave the link in the bio. It's my community. So please feel free to join me there. It's a lovely group where we discuss all these things in details, and yeah, you'll find like-minded people there. You can ask your questions, and you have access to me on that group. Alrighty. So, and obviously you can email me if you want to. Alrighty, it was good talking to you guys. Thanks for watching me today. Okay, bye.